Thank you for the kind words, Freya, and thank you for the invitation to present our work here today. As Freya mentioned, we're recently graduated from medical school in Bergen, and we're very happy to see so many students engaging in global health in sexual and reproductive rights. We all know that these are very important topics. We will discuss this for the coming days, but it's not a topic that's very well covered in the medical curriculum today. So thank you for giving us. Should I start over again or? Okay, good, thank you. So what we will do today is to present some work we have been doing in collaboration with Dr. David Bloom at Harvard. It is on the economic benefits of investing in women's health. And I think in the next presentations and the next days we will discuss a lot about the rights and the ethical arguments for why we should do this work. We think that the ethical arguments and the human rights arguments should be good enough, but at the same time we see that in the world today, also economics is important. So when decisions are made, also the costs and economic returns to the investments is taken into consideration. And in this study, we actually look into what are the economic benefits of investing in women's health.
Hello? Yeah, but so just to set the stage a little bit, as Freya and all the keynote speakers or remarks earlier today nicely stated, this is the student conference on sexual and reproductive health and rights. When we talk about sexual and reproductive health and rights today, of course, women's health and men's health is definitely equally important, and we cannot neglect neither one of the two genders to actually make progress. But we have chosen to focus specifically on women's health and looking into kind of the benefits of investing in women's health and why is that and how can we justify that. So just to start up and to set the stage a little bit, I just want to show you this photo. I don't know what you think when you see this photo, but at least I think it's uncomfortable to look at. It's something wrong. And I think you all have maybe the same notion of what is wrong. But clearly, that girl on the left is way, way too young to be wed to this man. So this is just to say that even though we have made a lot of progress when it comes to women's rights the last 20 years, we still have a long way to go. And women and girls are multidimensionally worse off in a lot of societies around the world. Just to give you an example, 14.2 million girls are wed away under the age of 18 every year. 1 in 9 girls are wed under the age of 15 every year. And some of the reasons and what kind of girls are being wed away at this young age. For example, living in poverty increases the risk by 2. That gives you 2 things that actually makes you lose your opportunities in life to actually secure your own rights. And we know that when young girls are being wed, the dropout rates from school are higher. They're less likely to actually get into formal labor first, getting an education, teenage pregnancies, and all the consequences that has for future health. And not only the future health of that girl, but also the future health of our children. So women are definitely in a worse off position, even today, in most countries in the world. Sorry. So already in 1994, Freya mentioned the groundbreaking conference in Cairo on International Conference on Population and Development. Until that point, during the 70s and the 80s, when we talked about, I'm not going to call it women's rights because we didn't talk a lot about women's rights, but we talked a lot about population control. But in 1994, people started to think and actually looking into women's rights and women empowerment, and we saw that, okay, we might have a problem with an increasing population, but how can we actually reduce those population numbers? And people started linking development, women's empowerment, education, and health. And Gro said that women will not become more empowered merely because we want them to be, but through legislative changes, increased information, and redirection of resources. And it will be fatal to overlook this issue. This was highly relevant then. It is still highly relevant today. Just last year, Gro held a speech at Harvard School of Public Health, and her core issues today is women's empowerment. A lot has been done, but a lot still has to be done. There are social, cultural, political, legislative barriers all around the world, inhibiting girls and women from securing their own rights and their own potential. So these are some of the reasons why we have chosen to look at specifically what kind of benefits can the society harvest from investing in the health of girls and women.
So Johanne pointed out very well why and how women in the world today still are worse off. So if we really want to grasp with this big problem that we're facing, we have to look across disciplines. We have to collaborate, and we have to look at this, taking all the complex issues into account. Because women and girls have limited opportunities and options throughout their lives in different spheres, in the world, in Norway, everywhere. So how to deal with this complex issue? Could health be a way to start, or at least one approach to start and continue the work we have been doing? And I think if we look back to the year 2000, when the Millennium Development Goals were established, we actually did look at health as an investment, because the Millennium Development Goals were based on a premise that we wanted poverty reduction and development. But as we see today, there are 3 health goals within those 8 goals. So health has been looked upon as a way to get us on the path to better development. And when we talk about health as a tool, we can say that health can give better wealth, and wealth can give better health. So it's not a one-directional arrow we have here, but a two-directional one. So if we start by looking at this graph, on the x-axis we see the income, and on the y-axis we see the life expectancy. And in this Gapminder graph, it seems like there is a tendency, there is a relationship between the income of a country and the health of a country. And also when we look at statistics from Norway, we see that better health tends to be more among the more well-off in Norway. And though there are differences between countries and within countries, it seems to be that better or more wealth also means more health. But in 1993, the World Bank delivered their yearly World Development Report. This time, for the first time, it was on health. The report is called Investing in Health. It's been heavily debated also the last years. There are many pros and cons, and it's a very interesting read. But after this, and with this report, there came a breakthrough, I would say. For the first time, it was also argued that if we were able to make our population healthier, also our countries and societies would be wealthier. Because if I am healthier, if I eat good food, if I'm living healthier, I'll be able to be more productive. I can invest more in my education and also my children's education. And maybe also the fertility would drop. So after 1993, there has both been the recognition that wealthier means healthier, but also that healthier means wealthier. And this has been very much focused on the general perspective of health investments as relevant for policymakers, also to promote society development. But as we now are entering the post-2015 agenda, we would like to ask, we know that health investments in general are good, but when we have to prioritize between some interventions versus other interventions, or one area versus another area, and also when it comes to population group, should we not analyze the health investments also on specific population groups? And with this as a basic framework for our work, we ask the question, is investment in women's health a missed opportunity for development?
So the framework we have based our research on is the one that comes up on the screen here. There's made some hypothesis when it comes to what kind of pathways does health investments actually improve and spur economic development, both at a local, national, and global level. So what we have looked into and what kind of studies we have looked into the past years is that we have seen different ways to improve women's health. For example, reducing iron deficiency, one of the most common micronutrient deficiencies in the world. 1/3 of all women in the world actually lack iron. What can actually that do with economic development, and through what pathways does it work? So if you, for example, take the example of iron deficiency, if we improve iron status in a local society, we actually see that women get more energy, and some studies show that they are more productive through quantitative ways. So a healthier workforce is a more productive workforce, increasing economic growth. A healthier workforce are able to be more productive, make more money, save more. Savings is extremely important when it comes to reinvesting in a society and actually make other actors come invest in your society as well. So it actually has massive and more important positive benefits than a lot of us actually thinks. One number 4, the education is probably clear for many of you. If you are healthier as a child, you will have better cognitive development. You'll be able to go to school, you'll be able to learn more, and you'll get a better education, which actually might possibly make life much better later on. The 2 ones that might be a little bit strange for people here is one on fertility and one on intergenerational health. Especially fertility reductions seems to have great impact on macroeconomic development in some countries. Because what we see in a country when development occurs is that with improved water, with improved education, with improved sanitation, child mortality drops. When child mortality drops a generation later or so, parents see that, okay, we don't need to get 6, 7, 8 children in the hope of 2 or 3 of them actually surviving. So we also see that one generation later, fertility rates drops. So if in that period between the drop in child mortality and the drop in fertility, we get a boom generation. There's a huge generation of people in productive age that have fewer dependencies. There's fewer older to look after, and there are fewer kids to look after as well. So if you actually soundly are able to employ that generation, that can lead to a massive macroeconomic boom in a country. And this is one of the theories behind, for example, the Asian tigers in the 90s. So this is very interesting. And what some people are looking into now is how can, for example, contraception, can it spur this demographic dividend in some African countries and some countries that are lacking behind. And a lot of research are being done now in Southern American countries to see if this was one of the drivers for the economic booms we are seeing there. So that's very interesting. The last one is the intergenerational health aspect, where we see that the health of a mom is extremely important for the health of her children, both boys and girls. We actually see that investing in women's health do increase cognitive development, increase schooling, increase possibilities for the children that are to come, so it's very important for future generations. So this is the theoretical framework we're using, looking into these pathways, and we have done a systematic review, very exciting. We've been looking at tons of literature out there. So our aim was, as we said, to systematically investigate the broader economic benefits and spillover of investing in women's health throughout their lifespan, so not just reproductive age. And the methods we've used a very strict guideline for making systematics review. It's probably not that interesting today, but what is interesting is that we have done a very cross-disciplinary search. We have searched health, gender, and economic databases. That is not often being done in systematics reviews today. And we searched 10 different databases, and we actually ended up with almost 21,000 abstracts that we have scanned. Out of those, 438 met our inclusion principles, and in our final review, we have analyzed 124 articles dealing with these issues, trying to answer them. So just to sum up a little bit of our feature, what kind of literature actually exists out there, and we think and hope we have captured most of it. So when we look at different pathways and look into what kind of research actually do exist within these different pathways, we see that it's very skewed when it comes to what kind of research actually has been done. So we find some actually quantitative data on productivity, how improved health actually do increase productivity. There's very little on savings. There's quite a lot on education. They've done some really interesting intervention trials in Southern America. There's some on fertility, especially when it comes to abortion legislation in the US and how that actually have impacted both education and primarily education and economic development in certain states in the US, very interesting data. And we have a lot on intergenerational spillover, how the effects of mothers affects the health of children. And maybe the most interesting there is some famine studies where we actually see what happens when a mother is really, really unhealthy and what happens to the children. And those children have been followed for a full lifespan, actually. So, yes. And just to summarize some of our findings. So, when we have such a broad field, we get a lot of different findings. To make it a little bit easier, we have tried to split it up into what are the costs of not investing in women's health, what are the costs of having poor women's health, and what are the benefits of actually doing it, because that's the two range of study types we have gotten. So looking into the costs, we see that definitely maternal health has been studied a lot, and we see that in particular malnutrition has profound effects on their children later in life. And what we talked a little bit about earlier is the intergenerational effects, and especially the fact that if a mom is undernourished, we see that the risk for her children to actually get what we call for cardiovascular diseases, diabetes type 2, when they again grow up is very interesting. And we think that is due to so-called epigenetic changes, that is genetic changes that doesn't go through kind of thousands of years as normal genetics do, but we have some genes in the body that can shut off and off during a generation depending on the external environment you're actually born into. So these findings are very interesting. For example, looking into both the NCD burden we are seeing today, and that we see that both in low and high income countries. The other thing we see, there's quite a lot on mental health issues in a mom. It's clearly that it's not very good it's not a good environment for a child to grow up in. We see that reproductive mortality and morbidity reduce overall household productivity, both in formal and non-formal sector. And we see that maternal complication and death is costly for a household in a low and a middle income countries. That in many cases that can be the thing that actually drive a family into a state of poverty. We also see that healthcare expenditure, out-of-pocket expenditure, is a big obstacle for many families and women around the world.
So Johanne described the costs of not investing in women's health, but there are also benefits that we should take into account and promote to our politicians so that we make sure that they listen and promote these benefits. So if we're able to reduce maternal mortality and they live longer, there has also been studies showing that these investments in their health have benefits for the increased investments in education. So if you actually are able, or if a family expect that the woman or men will live longer, we also invest more in our education, which is good. Also, access to safe reproductive healthcare services can reduce fertility. And reduced fertility, the reduction in total number of children, but also that we're having children at a later point, is good for a country's development in many cases. We see that when this happens, women do actually stay longer in education. They are more productive. There are more women are entering the labor force. And the studies we have included in our review are showing this a lot from the US, but also in other countries. And I think also grasping these important benefits, which are not medical in a way, but very good for society, should be taken into account when we look at the health investments. So, our review has shown that there are several spillovers of investing in women's health. And I think Johanne brought up early in our presentation that this is something that actually was recognized a long time ago. And with this study, we're even more sure that this is the case. Most of the studies are on intergenerational health, and a lot is done on studying women's reproductive role. So I think we are here today discussing sexual and reproductive health issues. And I think sexual and reproductive health is a particularly good case we have studied, and which we know will have large benefits for the women themselves, which is the really most important part, but also for the children, and for their family, and for their societies. So we should really try to grasp this and bring this into policy. Also, we think it's important to note that the poor rural women, which Johanne described in her first case, they're really worse off. We feel really sorry for this girl. And I think that is a good enough argument for investing in her health. But what our study also shows is that if we do not invest in these kind of girls and women, we will lose out so much that we can't really afford not doing that. So I think, and we think, and David Bloom thinks, that it's about to start acting on what we know. We have been discussing this for such a long time. We have compelling evidence, and it's time for us to place sexual and reproductive rights and women's health as a core aspect on the post-2015 agenda. This has been brought up in several of your presentations and aspects. And I really hope that the next days, but also in this year, that we will be able to take this forward. Because as I mentioned, the cost of inaction is too high, and it's a great opportunity for us to take this effort further. So we'd like to thank you for your time, and we hope that you will be as engaged as we are on this topic and promote women's health.
Much, Johanne and Kristine. That was a really interesting presentation. We will now open up for comments and clarifications. We have 5 minutes. No? We'll then move on to our next speaker, who is, let's see. Please state your name and title.
Okay, hi, I'm Arushma from University of Copenhagen, and I'm a medical student. It's a question to both of you, really. When you're addressing women's health and girls' health in the post-2015 agenda, one thing is to properly advocate for this issue. One thing is to put this on the agenda in political terms. What about on grassroots level? How would you, because there are a lot of, in these countries where this is an actual problem, you have a lot of cultural issues, religious issues that might get in the way of these things. So how would you incorporate that in your approach to women's health?
Yeah, thank you for a very good question. I think it brings it all back to where we started. This is a very complex issue. And I think when we look at the health discussions today, a lot of focus is on simple interventions, the easy picks. And I think for child mortality, we have been able to bring it down substantially. But when it comes to creating change in this way that we're talking about, it is very complex. I think we have to be sensitive towards cultural setting, religious views. It's easy to say that, yes, we bring out contraception to everyone. And I think we should do that, but we have to study what kind of setting do we implement these programs in. And I think linking it to our review, that there are studies from different settings which actually explore how can we do this in a more culturally sensitive way. So I think the easy way would go to say, let's do an implementation program of a standardized program everywhere, but I think we have literature showing that that doesn't really work.
There's a lot of ways to work on a local level, and I think a lot of us being here, maybe a lot of people start what you can say is the wrong way, from the top and down, and it can be a little bit frustrating sometimes, and it might not be the right thing to do even. I know at least Kristine and I have quite a lot of experience working, for example, in the UN system. And the UN system get a lot of criticism because we talk and talk and talk and talk and nothing gets done. That's the same over and over and over again. But then you have to remember again, how is the world organized? We're organized in national states. Like, there's no global governance or no one superior power that can say, okay, now every country is going to do that and that and that. And who actually fulfills our rights is the national states. If your rights are not fulfilled, if you live in Pakistan, there's nowhere you can go and say, hey, you have to fulfill my right. You can't try to go to the UN High Commissioner for human rights or something like that, but very little will happen. So what you actually have to do is try to persuade the leaders in those countries that this is the right thing to do. But then we have cultural barriers, we have traditional barriers, we have societal barriers, we have political barriers. So I think even though things takes a lot of time, for example, in the UN system, it's through these conversation normative change happens. So we have to talk and talk and talk and talk and not give up, because change actually happens in the end. Just imagine, even though we have a long way to go, so much have happened. Like, it's only 102 years since women got voting rights in Norway. So thing happens, but it takes time, and sometimes you actually have to use that time and actually think that it gains us, because it doesn't gain us to make a legislative change or an international convention if the leaders in that country is not willing to actually implement it. It's there on paper, but it doesn't happen in practice. So, but there's a lot of levels to work on, and there's a lot of things to think about. But yeah, we move on.
Thank you. Our next speaker is Malcolm